My name is Laura Gosens. The short story is I had, about 2 years ago, constant finger numbness, and it had been developing over the course of 2 years. I had tried massage, spent hundreds of dollars on that, but it was helping my symptoms, but it wasn't reducing it. Because we thought it was coming from neck and chest issues. I was at a massage conference actually where I met Dr. Koplen, and I had told him about my symptoms. So I had massage, I had 2 MRIs of my neck, of which the doctors found nothing. I had 2 neurologists look at me.
Well, that's what I thought, right. Okay.
And my general practitioner, and nobody could figure it out. And it turned out that that finger numbness was stemming from a fixated vertebrae in my neck, and that needed chiropractic care, and Dr. Koplen was the first person to really help me break through in my treatment plan, and he adjusted me, and instantly I gained full sensation back in my hand. My hand was buzzing, and I couldn't believe it that after a year I was finally figuring this out and starting to stabilize and getting massage, but I know that the chiropractic treatment is what really made the biggest difference in my improvement of health and my ability to keep my career as a massage therapist.
It really turned it around for you because, like you said, I mean, you're a great example where you tried a lot of other things, and other things are great, and they have their place. I'm one of the biggest proponents of massage you'll ever find, but you tried that. And then I'm curious too, you went to, your general practitioner, MD, you went to 2 neurologists, and they took MRI, and, they ruled out what I call medical pathology. You didn't have, fractures, tumors, cancer, infections, things of that sort. But what did they tell you? Because obviously they didn't really have an answer that helped you as far as treatment. What did they say?
So they said that there were no signs of a compressed nerve. There were no signs of a slipped disc. They even claimed that I didn't have thoracic outlet syndrome because of a bunch of tests that they did with pins and different sensations, and they were convinced that I had full functioning of my nerves in my hand, even though I was claiming that it was numb all of the time. And so their tests were not sensitive enough to pick up what I was experiencing, and Dr. Koplen's palpation skills of just touching my neck, he could figure out, oh, when I press here, does this intensify your symptoms? And I said, yes. And he adjusted me, and then when he pressed there again, the symptoms had relieved themselves. It felt like magic. I think that the main thing I appreciate, not only did Dr. Koplen finally figure out the missing piece, but I really appreciate how willing he is to communicate with me. He'll talk with me through my treatment here, and I get to ask questions and be really involved. I don't feel like it's when I go to the doctors and they have 10 minutes and they're in and they're out. I really feel like he's here to help me and answer my questions, and he's very involved in helping me get better. Yeah.
So I always wonder how many people are out there who, they just don't know, they never find their way to, quality chiropractic care when it's needed. And they end up suffering, unfortunately, needlessly.
Yeah, because they don't know better and they've never been referred.
Yeah, exactly.
Unfortunately.
Okay, wonderful. Well, thanks so much for sharing that. Anything else you want to add? Or?
No, I just got my adjustment and I feel great. I'll add that.
Okay, great. Thanks so much.
Thank you.